I thought that was Wakanda Forever there for a second.
It was.
All right, guys, here we go. Miracle Minute of the Week. And I want to bring this up to you because of really what it is. And it fits exactly in line with what I was just discussing. When I see a patient, there's steps that I follow, right? I've got techniques that I can use, different therapies that I can use. That's one of the advantages to studying all these different fields. You have different bits and pieces. You have things in your bag. Howard used to always tell me, Dr. Loomis, it's in your bag of tricks. What's in that bag of tricks and how you can utilize those things is really determines your success in practice, right? The more tricks you got in that bag, the better you get. So I've got a big bag of tricks. I'm like Santa Claus bag of tricks, okay? So I can dig in there. Case in point, Dr. Brown and I were in the office the other day. Young man comes in. He's got some problem in the upper shoulder area, trouble breathing, lots of sharp pain. You know, his father is in the profession, has helped him and done some work with him. So we're looking at that and saying, okay, Dad's got involved, but didn't get it. Dr. Brown helped me out that day. I was running behind, shocking as that may seem. I was running behind, dealing with other things, other patients, and I get in there with him, and I'm saying, okay, and Doc's like, hey, man, I've tried this, this, and this. So for everything I see in practice, and this is a general rule of thumb, I will usually have about 10 treatment options that I can go to. I put them in a pecking order of the ones that work the best the most. And I just work my way down the list when I'm working with a patient. So Dr. Brown and I were sitting there, and when he came on board in our practice, I took 2 of my techniques that I do that I feel work the best across the board, and that's what I've trained Dr. Brown in for the past year. Now, he was already a physician when he came on board, right? He'd already been practicing for 3 years. So he's already had experience, and I trained him in what I do with the 2 techniques that I use the most. And he's really become quite skillful. And what's nice about it is when I walked in that room, I know, okay, he's already done these 2, and they didn't get it. What's the cause? What's driving this? What do I have to do next? So I went to number 3 on my list. Didn't get it. Went to 4. Didn't get it. Doc and I are sitting there sweating. Now we're like, uh-oh, I'm 4 into the hole here. Keep going down the list. 5 didn't. 6 didn't. I'm thinking, man, I'm running out of options here. I hit option number 7. It was a vector, an angle, and a style that I had to use. And bang. Just like that. It got it. Guy gets up off the table, goes, that's it. It got it. That's what I'm talking about. But the idea is I had to go 7 deep in my list of how to treat this condition before I was able to find something that would make that change. I see that a lot in practice. So one of the reasons I brought Dr. Brown on board to help me was because I thought, gosh, if I can teach him the first 2 things that I do that help 70% of the people that walk through my door, then I can allow him to help those people. And when those don't work or they're not the right answer all the way, then I can dig further into the hole and go a little deeper down the well.
Yeah.
But it takes time. And that's the real kicker to this. It takes time. If I use technique number 1 and say it takes me 3 minutes to do it. All right, I'm 3 minutes into my visit. What if 2 has to be used? 3 more, 4 more. Now I'm 4, 5, 6, 3, 6, 9, 12. Now you're 17, 18, 20 minutes in, but you're at that dilemma, right? We talked about this last time. Do you let him go or do you help? I like to help. So when we're doing this, the good news is, guys, we're going to find it. And we're going to help get it out of there. And once I get it that first time, then it's easy to get out of there the next time because I know what to do. I don't have to worry about it's not that pecking order. So I wanted to use this little miracle minute for you to show you that it's not always the first option that works. It's not always the second, the third, or the fourth. In this case with this gentleman, it was the 7th technique that we chose to do. The 7th therapy that we chose to implement. But it got it. That's really, really cool. And that's a great, in my mind, miracle minute. Now it fits in line